I was asked to talk about ADHD for a bit, so I thought I would do that. Okay, so ADHD, attention deficit hyperactivity disorder. Now, it used to be called ADD, but the nomenclature changed, and so now we have three types of ADHD. We have ADHD attention deficit type, where attention and concentration problems are the predominant problem. We have ADHD impulsive hyperactive type, and that's where predominantly you have all of the hyperactive impulsive symptoms, and then you have the combined type. Okay, interestingly enough, for the most part, the treatment is the same for all of them, but in general. But anyway, those are the distinctions. Okay, so in the attention deficit type, some of the main things, and I'm not going to cover all of them exactly because I don't recall all of them by memory, but you can always Google DSM-5, and they will give you and ADHD, and it'll give you all the criteria. But you have to meet the criteria in order to make the diagnosis. And okay, so usually it's difficulty maintaining and sustaining attention, easily distracted. You procrastinate, you put things off because you know it's going to be difficult to do because of your attention and concentration issues. You oftentimes, because you're distracted, you skip from one thing to another, and oftentimes you don't get anything done because you start to work on one thing and then you get a thought about, oh yeah, well, I should do that. So then you go over there and you do that, and then you go, oh yeah, maybe I should get that, and then you go over there and you do that, and you never actually stick it out and finish one particular thing. Okay, so there's that. Then there's like you're forgetful. You forget a lot of stuff. You misplace and lose things. You People often say that you don't seem to be listening when they're talking to you. The hyperactive impulsive stuff is mainly you feel like you're being driven by an engine. You've got racing thoughts. You're all over the place. You're fidgety. You can't sit still. You can't sit through a movie without getting up. You can't sit through a TV show without getting up. You're always getting up, moving around, doing stuff, and you can be impulsive and you can be aggressive. And okay, and then there's the combined type. Now the thing about diagnosing ADHD also is that for the most part there's a certain age limit when it's supposed to have started when you're in your early years, and that you're demonstrating difficulty with these symptoms and problems. People talk about adult ADHD. Now I don't believe that's true. I don't believe there's an adult ADHD in the sense that you're 45 years old and suddenly you develop ADHD. Okay, this is a brain disorder. This is not a psychological disorder. This is truly a physiological brain disorder when you really do have it. So when people say as an adult they're 45 years old, they come in and they say, yeah, I've got it. I think I got ADHD. And I ask them, well, did you have it when you were a kid? And they say no. Then in my opinion, it's not ADHD, it's something else. If they say yes, then what it means to me is that they've had it their whole lives, but it was never acknowledged or recognized or treated. And then oftentimes it's like a parent comes in and says, my 8-year-old kid was just diagnosed with ADHD, and I realize I do the same thing. Or my kid just got diagnosed with ADHD, and I happen to take one of his pills, and boy, do I feel good. So a lot of times that's it. So normally ADHD does not occur as an adult. You had it already, and it was just never recognized or diagnosed or treated. Now, the very important thing that people don't understand, that many people don't understand about ADHD, is that if you have attention and concentration problems, you don't automatically have ADHD. Like everything, you have to do a differential diagnosis. You have to rule out other things that may be causing attention and concentration problems, and there are a lot of them. If you are depressed, you can have attention and concentration problems. If you are anxious, your mind is all over the place. You can have racing thoughts when you're anxious, and you can't think straight. So anxiety disorders, depression disorders, bipolar, manic, or bipolar depressed, bipolar manic. You can have attention and concentration problems. Schizophrenia, you can have disorganized thinking, attention and concentration problems. So there's a lot of different things that can cause attention deficit issues. And so consequently, Just because you feel you are easily distracted and you're having attention and concentration problems, you can't assume that. You need to go to a doctor and get it properly diagnosed. Okay. Now, yeah, is it? And you really do want to have it properly diagnosed, because if your attention and concentration problems are due to depression or anxiety or bipolar or schizophrenia or something else, PTSD, whatever, OCD, you're not, taking a stimulant, which is a treatment for ADHD. Yeah, you may feel energized, and it may help with attention and concentration, because it often helps anybody, but it's not going to solve your problems because you're not addressing the source of the problem. Additionally, I would say to you that all these, it's overly diagnosed, and stimulants are abused, are massively abused. If you're going to take a medicine for ADHD and it's a stimulant, you really should try to take the least amount that works. Okay, these are not non-toxic drugs. Okay, for the primary drugs that people use for ADHD, there's the dextroamphetamine salts, which is basically speed. And then you have the Ritalin products, which are, and then you have Strattera, which is not exactly a stimulant, but does the same thing. And then you have some other, there's other stuff too, and even two antidepressants like bupropion, or Wellbutrin, as it's better known, or Effexor. These are antidepressants that oftentimes help with attention deficit issues. Sometimes when people come in, they've got depression and they've got ADHD, they've been diagnosed with both. Sometimes you can kill two birds with one stone by using one of these medicines. But the whole point about most people are on Adderall or Concerta, and these medicines can affect your heart. Okay, they can affect your heart, your blood pressure. For many people, it doesn't create a problem. If you've got a heart condition of some sort or an arrhythmia in the first place, you definitely should not be doing this. Any heart defect or problem, you should not be taking stimulant medications. But these medications can affect your heart and blood pressure. They can possibly cause a seizure. And over time, I believe they can cause neurotoxic problems with your brain. With all medicines, I really encourage people to use the least amount that helps them to manage and deal with their problem. And to periodically see if they don't need the medicine anymore, to taper down and discontinue medicines periodically, maybe once every 6 months or a year, to see if they can do without them or with a lower dose. Because chronic use of any drugs, including antidepressants, mood stabilizers, whatever, is not good for you. Now, we don't have all the research and data to know whether it's decreasing your lifespan or really physiologically at a molecular level hurting your liver, your kidneys, etc. Sometimes it's really obvious that the medicines are doing that, but it can be very, 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 very subtle. There are people who've been on Zoloft, Prozac for 20 years, and they seem fine. But do we really know that they're fine? Do we really know that this isn't contributing to eventually to early onset of Alzheimer's or something else? Or we don't know. In general, we are very cavalier about the drugs that our doctors give us. Oh yeah, take this and it'll help that. And you're getting like a side effect from this? We'll take that. Oh, there's a side effect from that? We'll take this. People come in with like a dozen medications. It's insane. You really have to be careful. If a doctor says you got elevated cholesterol, I want to put you on Crestor or something, and that's his first thought. Maybe the first thought should be diet and exercise, right? Maybe that should be the first thought, to try to control this through diet and exercise. If you need a cholesterol medicine, you take it, and again in the least amount. But a lot of times doctors are quick to fire off a drug, and a lot of times and people are just going to go, okay, fine, great, boom, I'll take it. And when you take a whole bunch of medicines, there are often drug-drug interactions that can create problems. And a lot of times the doctors don't even look that up. People will come to me and they'll call me. I mean, when people come to me and I see they're on 6 medicines and I want to prescribe something, whatever it might be, I recognize the possibility that there could be drug-drug interactions, so I plug it into my computer phone software app, Hippocrates, and I can see if there's drug-drug interactions. And if there are, then I warn people, you got to get off. If you want me to give you this, you got to get off the Elavil. If you want me to give you this, you got to get off the Tramadol. If you want me to give you this, you got to get off of that. A lot of doctors don't even do that. They don't even look this stuff up. A lot of times patients call me from their GP or from their other doctors and say, doctor wants to put me on this, or he started me on this. Is it okay? And then I got to do their job to see if it's okay. And I don't mind because I want to keep my patients safe, but it's sloppy medicine. And it's sloppy of people, of patients, of us, if we don't ask our doctors questions, if we don't inform ourselves. I've said this before. If you've got elevated cholesterol, and the doctor says he wants to put you on Crestor or Lipitor or whatever it might be, and you ask questions about it, and if you don't even know anything about it, to ask questions about it, go home and Google Lipitor, Crestor, whatever it might be. Go home and Google treatments for elevated cholesterol and triglycerides, and then if you still feel it's a good idea, that the benefits outweigh the risks, then you take it. But if you don't, you call the doctor up and go, I have some second thoughts. And I've been doing some Googling, and I'm thinking maybe this one might be milder and easier and a place to start. If your doctor gets really angry and defensive because you are challenging him or trying to be part of the treatment team, you got the wrong doctor. Okay, this is a collaborative process, and you have a right to be part of that process and part of that decision-making process. In fact, if you're not, that's the whole point behind informed consent. That you are aware of everything before you take something. You are aware of the risks, the benefits, possible side effects, and the alternatives. And some of the alternatives might actually be better for you. So the doctor's supposed to go through all of that stuff and then get your consent. A lot of times doctors don't explain anything. They just give the medicines, give a prescription, kick you out the door. It's not cool. Okay, so I started this whole conversation about ADHD. And so the point is this, if you think you've got attention and concentration problems, go get it checked out. Be wary of taking any of these stimulants. And if the doctor does start you on a stimulant, ask him to start you on the lowest dose and take it for a period of time to really know whether it's doing something or not. And also with ADHD, a lot of it has to do with behavioral stuff. You might not necessarily need a medication or as much medication if you put other things in place, other behavioral organizational things in place. So if you have problems forgetting things, you're always late, you forget appointments, etc., you got a phone, right? Most people have a phone. You put in your phone reminders, alarms. First of all, you need alarms to tell you to take the medicine sometimes, but alarms and reminders about appointments you have to make. You should put everything about your life into your phone. Okay? When you get up in the morning, you should look at your phone, look at your calendar, and see everything you need to do. Okay, then you're going to know what's going on, and you're less likely to forget an appointment. If you forget stuff that you need to do in general, make lists. Okay, make lists and look at the lists every morning to make sure, and prioritize the lists so you're dealing with the most important things first, and look at the list every morning and make sure you're paying attention to everything you need to do. Okay, so you're not going to miss filing the tax deadline. You're not going to miss doing a book report, whatever it might be, because you've got a to-do list. You've prioritized it. Maybe you've put down deadlines for when these things need to be done. If you put this effort into organizing, you're less likely to make mistakes. You're less likely to forget appointments. You're less likely to screw things up. You're less likely to wait to the last minute to get stuff done. And you do a half-assed job. Okay, so these are things that you can do that might enable you to avoid taking medications or to take the least amount. Also, a lot of times people with ADHD spend a lot of time looking for stuff. Why? Because they threw it on the ground somewhere, on the sofa, and it fell between the cushions. Or, you come in the house, you don't just you throw stuff down. You put your wallet or your purse or your keys, you put them in the same place. You got a place, you put them in the same place when you come home. You take the few extra seconds to put them in the same place. If you go to your toolbox or whatever, and you take out a screwdriver or a hammer, and then you go to another room and you fix the picture frame or whatever, you don't put the hammer and the screwdriver down on the ground, okay, or on the sofa or on the bookcase, and then go on to your next activity. You take the time to put it back in the toolbox. Why? Because next time you need it, you go to the toolbox, it's going to be there, as opposed to you having to hunt around for an hour and a half trying to remember where the hell you put the stuff. Okay, there are ways to make your life easier. People say you don't seem to be listening when they're talking to you. You've got to make an effort to be vigilant over this, to make eye contact, to try to screen out other thoughts as you're listening to what somebody is saying. In terms of procrastination, if you tend to procrastinate and put things off, again, set up deadlines so that when you can procrastinate, but at a certain point you got to go, no, now I got to do the work, because if I keep on procrastinating down to the very last minute, it might be really bad. It might not be my best work. I might not even get it done at all. Okay, so there are behavioral ways to treat ADHD that might reduce the possibility of needing medicines, and you want to look at that. Now, there's other stuff. There's other things that can help ADHD. There's this new treatment called neurobiofeedback. It's called brain paint. That is a neurophysiological thing. You put electrodes on your brain, and it's a whole gizmo thing. But the research is showing that can help, and that you might not need medicines at all if you go down that road. Anyway, this was just a brief bit. Hope it helped.